In today's world, robotic technology is developing rapidly. So what do you imagine the world will be like with all these high-tech robots? Well, according to a book, The End of Work, by 2030, 70% of the jobs we know today would disappear. Jobs like Uber drivers, pharmacists, and also even lawyers. And by 2050, only 5% of the jobs we know today will still exist. So what happened to the other 95% of the jobs? Well, it is predicted that all these jobs would be replaced by robots. So robotics is prospering in all fields today in an overwhelming speed. We can see robots in manufacturing, we can see robots playing golf, and also we can see them in our medical systems. For surgeons, there are robotic arms called Da Vinci. It works like this. The surgeon sits in front of a controller and remote control these robotic arms to do surgery with the movement of their fingers, just like playing video games. And with the help of these robotic arms, the surgery will become more accurate. Also, we have some healthcare robots in Japan, which helps the elders with their daily lives, like lifting them up from a wheelchair and moving them to beds. So it might seem like these robots are helping doctors and medical staffs, right? But in the future, would robots replace roles of doctors someday? Well, actually, there are already companies designing robots with similar features. They can make simple diagnoses, like they can tell you what disease you get and give you medical advices. For example, like Dr. Google is an online AI doctor which can provide us with health information and also second opinion. So after hearing all of these things, you might still wonder, why do we need a robotic doctor anyway, rather than a human being doctor? So let me tell you why. Well, I am a medical student in my 5th year. So that means I've studied medical knowledge for almost 4 years. But in clinics, I usually still can't correctly diagnose a patient's disease. So what happens if a patient comes to me and asks, Doctor, what disease do I have? I'm so anxious. Well, of course, I can say to him, well, I don't know. I'm only a student. What do you think I know? But as a professional, I have to give the patient a satisfactory answer, even if I actually don't know nothing at all. So if today a patient walks in with fever and difficulty in breathing, what should I do? I can say to him, well, Mr. Hoy, don't worry. You know, fever is a very, very common symptom. Actually, you don't need to hold my hand, Mr. Hoy. It can be infection, autoimmune disease, or malignancy. And since you have difficulty in breathing, right? So your lungs might be involved in this case. Please wait a moment here. I'll get you some pamphlets so you can know more about your disease, okay? Okay. Then I walk out of the room, make sure that the patient can see me, and take out my cell phone. Enter all the symptoms he said in Google, fever, blah, blah, blah. Okay, and the diagnosis come out. Then I can return to the room and confidently say to him, so Mr. White, it's most probable that you have pneumonia with streptococcus infection. And here are some pamphlets for your reference. So you see why we need a robotic doctor? Because robots have a vast storage of information and a big database. So they don't have to ask Google anything because they themselves are the equivalent of Google's. Robotic doctors can help us analyze the symptoms and the results of the examination. And they can pick the most possible diagnosis in a very short time. And after the diagnosis, they can suggest the best treatment for us according to the latest scientific studies. Also, robots can store our past medical history, so it can prevent drug-drug interaction or allergy. So do you still think that letting a patient come to an inexperienced doctor like me is a better way than seeing a robotic doctor? I believe with the progress and the development of diagnostic robots, a large part of the young doctor's job will be replaced. But once again, does that mean that all of the future doctors should be worried about losing their job and be replaced by robots? No, I don't think so. Because there are two elements in medicine that is difficult to be replaced by robots. One of them is the ability to invent and create. And the other is building interpersonal connection with communication. So innovation in medicine requires medical scientists and researchers to be creative, while in clinical practice, trust and connection are two of the most important elements in medicine. The connection between a patient and a doctor is very hard to be replaced by a robot. And once only if the patient has confidence and trust in the doctor can the treatment go smoothly. So today, when a doctor explains the disease to a patient and trying to empathize and care for the patient's illness, only by that time can they form mutual trust in each other. And with this relationship, we can comfort the patient's emotions and also boost their confidence in fighting against diseases. So this is what a human doctor can provide, but a robotic doctor can't. Love, care, and sincere communication. So with this in mind, and as a doctor to be myself, I not only have to master in medical knowledge, but also these irreplaceable skills that are unique to human, innovation and interpersonal communication skills. But this also applies to all walks of life. If we all want to have a prosperous career in the future, I think we should choose one profession with these two elements, so it is less likely for us to be replaced by robots. If we master these human skills, robots will become an aid to us instead of a threat that may replace us anytime. And with the help of these medical robots, doctors can spend less time doing paperwork or analyzing data. Instead, they can spend more time listening to a patient's real need, form a tighter bond with them, and build a stronger connection with our patients in the future medical world. TME.